The widely used over-the-counter drug paracetamol, also referred to as acetaminophen in some regions of the world, is renowned for its capacity to reduce fever and relieve pain. When used properly, it is regarded as a secure and useful option. However, excessive paracetamol use can have negative health effects, just like with any medication. The effects of taking too much paracetamol, potential risks, and the significance of responsible use are all covered in this video. Understanding paracetamol. Common uses for paracetamol include treating minor aches and pains like headaches, muscle aches, and toothaches, as well as lowering fever. It functions by lessening the brain's production of prostaglandins, which are chemicals involved in the transmission of pain signals and the induction of fever. Paracetamol is generally regarded as safe when used sensibly and within recommended dosages. However, going over the advised dosage can negatively impact your health. What occurs when you take too much paracetamol is as follows. 1. Liver injury. Paracetamol is metabolized primarily by the liver. When you take paracetamol, your liver converts it into safe byproducts that are subsequently eliminated from your body. However, if you consume too much, the liver may be unable to handle the workload. In particular, N-acetyl P-benzoquinone imine, NAPQI, which can seriously harm liver cells, may be produced as a result of this. 2. Sudden liver failure. Acute liver failure can develop if a lot of paracetamol is consumed. This is a potentially fatal condition that can cause a variety of symptoms, such as bleeding, confusion, and jaundice, yellowing of the skin and eyes. Acute liver failure can be fatal if it is not promptly treated. 3. Kidney injury. Excessive paracetamol use can harm the kidneys in addition to the liver. When the liver is overworked, toxic byproducts can damage the renal tubules and possibly cause kidney dysfunction. 4. Delayed symptoms. The fact that paracetamol overdose symptoms may not appear right away is one of the most alarming aspects of the condition. This can give people a false sense of security, making them think everything is fine when in reality, their organs may be seriously damaged. Early intervention and medical attention are essential because symptoms can take several days to appear. Prevention and treatment. You must seek immediate medical attention if you believe you or someone you know has taken too much paracetamol. Healthcare providers can give patients treatments like activated charcoal to absorb any paracetamol that may still be in their stomachs and drugs like N-acetylcysteine, NAC, to counteract the liver's toxic effects. When it comes to avoiding paracetamol overdose, prevention is always the best course of action. As a precaution, abide by these rules. 1. Follow recommended doses. Paracetamol should always be taken as directed on the label or as directed by a healthcare professional. Do not take more than is advised or take more than 2 doses at once. 2. Use caution when combining drugs. Paracetamol may be an ingredient in some over-the-counter and prescription medications for the common cold and the flu. When taking multiple medications at once, pay attention to the total amount of paracetamol you consume. 3. Avoid chronic use. Paracetamol should not be used continuously or in excess. Consult a medical professional for an accurate diagnosis and treatment plan if you frequently experience pain or if you have a fever that won't go away. When taken as directed, paracetamol is a useful medication. However, consuming too much can have negative health effects, particularly with regard to kidney and liver damage. Always take medications as directed, steer clear of mixing paracetamol with other medications, and contact emergency services right away if you think you may have overdosed. When taking any medication, you should always put your health and safety first.